So with us today is Andy Troszok, who's the president of the Extended Care Pharmacy Ltd. Welcome, Andy.
Hello.
Hi. Can you give us a little bit of background on how you started in the pharmacy industry?
Well, a difficult choice in university, as everyone has. I think I enjoyed health sciences. I wanted to look at some kind of practice-based health science profession. And pharmacy seemed to be the most broad-based. It had a lot of opportunity to get into industry, into teaching, into academia, and also into private practice. So at the time, that was the decision I made.
And when did you actually join into the pharmacy industry? Was there an internet pharmacy? Was that even something you thought of, or?
No, when I remember going through my university career, it was typically either a hospital career or a community-based career. But the whole aspect of distance-based delivery of care, or mail order, or internet, as they're synonymously called, wasn't even an option. So I think that is something that has been relatively new, probably the last 5 or 6 years.
Really?
Yeah.
So would you consider yourself a pioneer?
I don't know if pioneer is the right word. I think it's innovation. I think with technology, all aspects of healthcare being explored in terms of how to provide care, be it telemedicine, where doctors are using video conferencing with distance communities, such as some of the native communities in Canada that are in the north, to the technology used with electronic health record. So I think what you're seeing is technology is taking medicine and healthcare to a different level. And I think mail order pharmacy or internet pharmacy is just a natural progression. And I think only in the last 5 years have pharmacists really realized that they can use that tool to deliver care not only to patients that walk into the pharmacy, but patients down the street, in another province, and in another country.
So tell us a little bit about the Extended Care Pharmacy.
Extended Care Pharmacy is a mail order pharmacy based out of Calgary. We service American clients predominantly, although we are starting to service Canadian clients as well. We started 5 years ago, and again, it was that natural progression. In that natural progression, we've also opened up pharmacies in the United Kingdom. We have a pharmacy in the European Union, New Zealand, Australia, and we feel that healthcare is becoming a global market. We're continuously hearing how patients are choosing to have elective surgeries performed in either various provinces or various countries. Most recent one is Cuba is becoming an area where even our federal government is looking at sending patients to do certain procedures because of the cost benefit associated with it. We have, for example, MRIs being read and diagnosed in Bangladesh by doctors there because, again, of the cost ramifications associated with doing it here. So we are expanding into a global economy, and I think we as a company see the opportunity to expand to a global economy to provide pharmaceuticals to our customers.
Yeah, you have a little bit of history on speaking about the subject of, fair and accessible medications for everyone. Can you tell us about that?
Yeah, about 4.5 years ago, I became the vice president of the Canadian National Pharmacy Association. And in that capacity, I was asked to speak before Congress on 2 occasions on the safety of the Canadian pharmaceutical system. Many of our critics in the United States, predominantly the pharmaceutical industry, would like the American public to think that any medication outside of the United States is possibly counterfeit and unsafe for the U.S. consumer. But ironically enough, those same companies actually work on a global market. They do not even manufacture most of the pharmaceuticals in the United States, and the same companies that provide medicines in the United States provide medicines in Canada, in the European Union, in New Zealand and Australia. So these are the same pharmaceuticals manufactured by the same companies. So in terms of my public speaking or my lobbying, as you would say, I have, again, testified before Congress, and I've been to the White House. I've worked with various congressmen and senators to try to push forward legislation that would make affordable prescriptions available for the U.S. public. I think one important point is that the global conglomerate multinational companies go worldwide to manufacturing areas that it's cheaper for them, so they can make more money and more profits. But those same companies try to restrict the U.S. consumer where they can purchase their medication. We feel this is completely unfair, and in many cases un-American, even though I'm not an American citizen. But we do feel that it's unfair for the U.S. consumer to be put in that spot. And that consumer should have the right to purchase, as they do any other products, their medications on the global market. Now that being said, they have to purchase them within a safe framework. And I think that's what we've strived for over the last 5 years, is to establish a very credible, safe network for our customers to purchase within.
If we were to ask one of your customers today how they feel about your company and about your service, what would they say?
Well, it's interesting because we have countless amounts of customer testimonials and statements. I think, if you're a U.S. consumer, you understand the state the U.S. is in terms of the cost of medication. We have countless people that have told us that until they found us, they were choosing between eating and taking their medications. We're talking about people who are fixed income, be it that they're seniors or elderly or even the working class, where they don't have health insurance. They can't afford medications that are priced thousands of dollars on a monthly basis. So I think our customers, first and foremost, are very grateful that they have us as an option. Because in many cases, they would have no other option. They would either not take their medication or take their medication appropriately, or maybe go to a source that does not have credible medication. So I think our patients and our consumers really appreciate the service we provide. And I think they're also very comfortable because they understand that we are a licensed entity in every jurisdiction we provide our medications. So we do use licensed pharmacies within each jurisdiction that are regulated by their government. This is not done out of some warehouse that is uncontrolled in some free trade zone. This is done under the guidance and framework of industrial countries that follow the same guidelines that the United States does. And I think that creates that enormous sense of safety, credibility, and savings to our customers. The cost of healthcare in the United States is going through the roof. The largest component of that increase in cost is prescription medication. Currently, extended care pharmacies work with 10 companies to provide the employers savings on their overall expenditures on prescription drugs. If the employer can save money on their prescription expenditures, they can provide more benefits to their employees. So it becomes a win-win situation that Care Pharmacy can provide the reduced cost of prescription drugs to the U.S.
Now, how do you do that?
Well, basically, it's the same thing as an individual customer coming to us, but now it's a company saying, let's say I have 50 employees, we provide, we're a self-insured company, we provide health benefits to our employees. So then the employer contracts with us, and we provide all of the prescription medications for that patient. The nice thing is that Extended Care Pharmacy also has a U.S. pharmacy called Smart Choice Drugstore. So now we're able to provide both the Canadian saving component and the U.S. saving component to the corporation. The corporation then again saves money and can provide further benefits to their employees. Their employees actually work directly with us, so they will send in all of their prescription needs. We will go through the prescription, into all the prescriptions, then we'll determine where the best price is in the United States or is it in Canada, and then we will send those medications directly to the patient's home.
So you do truly offer a competitive package for the employees and the employers? Absolutely.
It's a one-stop shop. They deal with us, they send us all their prescription, then we decide for them in terms of where the best pricing is.
That's fantastic. Thank you so much, Andy.
You're welcome.